Welcome to this online class on veterinary anatomy where Professor Govind Narayan Purohit explains the joints of the forelimb including the type of joints, the blood and nerve supply to the joints of the forelimb, and the muscles and ligaments of the forelimb. This lecture will be specially useful for students of universities that have adopted the veterinary anatomy syllabus as per MSVE Regulations 2023. So here are the contents of today's lecture. The first joint in the forelimb is the shoulder joint. It is a ball and socket type of joint between the scapula's glenoid cavity and the humerus head. The joint comprises a loose capsular ligament and supported by surrounding muscles. The primary movements of this joint is extension and flexion, and to a limited extent it can have adduction, abduction and circumduction. There are some species variations in this joint. Dogs have a raised glenoid cavity rim with a marginal cartilage. Pigs have reinforced cruciate bands on the front of the capsule. Next is the elbow joint as shown in the picture. It is also known as cubital joint. It is a composite joint consisting of humero-radioulnar articulation, which is a hinge joint, and radio-ulnar articulation, which is a pivot joint. The ligaments of elbow joint. The capsular ligament forms a pouch over the olecranon fossa. The medial and lateral ligaments provide stability. The primary motions of this joint are extension and flexion. In dogs there is limited rotation because of the trochoid nature of the radio-ulnar joint. The knee joint, carpal articulations. The knee joint is a composite joint consisting of radio-ulnar carpal joint, condyloid, and the proximal carpal, intercarpal, distal carpal, and carpo-metacarpal joints, arthroses. The ligaments of this joint include the dorsal and volar capsular ligaments, the lateral and medial carpal ligaments, and the carpal sheath, carpal canal, enclosing flexor tendons and neurovascular structures. The primary motion of this joint is flexion and extension. Small degree of abduction and circumduction can occur in the radio-ulnar carpal articulation. Intermetacarpal articulation. This joint has both diarthrosis, movable, and amphiarthrosis, partially movable, motions. The picture shows the ox and horse metacarpal bones and attachments. The ligaments of this joint are capsular and interosseous ligaments. The joint has limited vertical gliding. The fetlock joint, also called metacarpophalangeal articulation. This joint is ganglimus or hinge joint. The joint comprises of large metacarpal bone, first phalanx, proximal sesamoids. The ligaments of this joint include collateral ligaments, abaxial and axial, and the sesamoidian ligaments, proximal, distal, collateral, intersesamoidian. The primary motion is flexion and extension. Interphalangeal articulations. The pastern joint is a hinge joint between the first and second phalanx. The ligaments of this joint are capsular, abaxial, axial collateral, and volar ligaments. The interdigital ligaments prevent excessive abduction. The coffin joint is a hinge joint between the second and third phalanx, including the navicular bone. The ligaments of this joint are capsular ligament, dorsal elastic ligament, and collateral ligaments. Navicular ligaments, superior and distal, are also present. The motion of this joint is flexion and extension. Now we discuss the blood supply to the forelimb. The major arteries that supply blood to the forelimb are suprascapular artery, supplies supraspinatus, subscapularis. External thoracic artery, feeds pectoral muscles. Subscapular artery, supplies scapular and shoulder region. Deep brachial artery, supplies triceps and anconeus. Median artery, main artery of the forelimb, supplying digital flexors. Radial artery, contributes to the carpal blood supply. Ulnar artery, branch of median artery, contributes to digital circulation. The venous drainage is through the cephalic vein, major superficial vein, drains into the external jugular vein. The picture shows the major arteries, veins and nerves of the forelimb, and their branches. Nerve supply to the forelimb. The brachial plexus is a network of nerves formed by the ventral branches of the last four cervical and the first two thoracic spinal nerves, C5, C8 and T2, in cows and many other mammals. This plexus is responsible for supplying nerves to the forelimb, providing both motor and sensory functions. The major nerves that innervate the different structures are suprascapular nerve, innervates supraspinatus, infraspinatus. Axillary nerve, supplies deltoid, teres major, minor. Ulnar nerve, innervates flexor carpi ulnaris, superficial digital flexor. Median nerve, supplies flexor carpi radialis, digital flexors. Radial nerve, largest nerve, innervates extensor muscles of the forelimb. Motor functions, the brachial plexus nerves control the muscles of the shoulder, arm, forearm, and some muscles of the hand, enabling movements such as flexion, extension, and rotation. Sensory functions, it also carries sensory information from the skin of the forelimb back to the brain, allowing the cow to feel touch, pain, temperature, and proprioception, sense of body position. The lymph nodes of the forelimb include the prescapular lymph node that drains the skin, forelimb, and thorax, and the axillary lymph node that drains the muscles of the shoulder and forelimb. Now we discuss the nerve blocks in the forelimb. The median nerve block is performed below the medial tuberosity of the radius. Ulnar nerve block, near accessory carpal bone. Volar nerve block, high and low volar blocks for metacarpal nerves. Radial nerve block, targets extensor muscles of the forelimb. The nerve blocks are used for managing pain and performing surgical procedures on the forelimb. Blocks like the median, ulnar, and radial nerve blocks are commonly used for treating injuries or performing minor surgeries. Now let us discuss the biomechanics of locomotion. The key principles involve static, dynamic, center of gravity, and lever-like functions. The locomotor system in the forelimb is comprised of muscles, bones, and joints working on lever principles. Since the trunk acts as a suspension bridge, thus forelimbs bear more weight than hindlimbs. The stay apparatus prevents fatigue and stabilizes the weight-bearing joints. The forelimb stay apparatus include the serratus ventralis, lacertus fibrosus, and the suspensory ligaments. The hindlimbs bear less weight but are more accurately angled. The stay apparatus of the hind limb include the tensor fasciae latae, the gastrocnemius muscle, the pavonus tertius muscle, and the deep and superficial digital flexors. The adaptations for hind limb stability are that the hip is firmly attached to the trunk, the stifle and hock extend simultaneously, and the oblique trochlear ridges of the tibial tarsal in horses aid movement. Horses have a unique ability called the stay apparatus that allows them to sleep standing up without becoming fatigued. This mechanism involves a combination of ligaments, tendons, and muscles that lock the major joints of the legs in place, enabling the horse to remain upright with minimal muscular effort. The major structures of the stay apparatus of horses are the biceps brachii tendon locks the shoulder joint. The triceps muscle helps extend the elbow joint. They have superficial and deep digital flexor tendons, and the suspensory ligaments and the superior and inferior check ligaments support the fetlock and pastern joints. The functions of the stay apparatus is that they prevent the collapse of the shoulder, elbow, and fetlock, and transfer body weight passively through tendinous structures. The hind limb stay apparatus of horses. The major structures include the pavonus tertius, the deep and superficial digital flexors, the suspensory ligament, and the collateral ligaments of the fetlock. The patellar locking mechanism allows the patellar, kneecap, to hook over a ridge on the femur, locking the stifle joint. The reciprocal apparatus links the stifle and hock joints, so when one joint is locked, the other is also stabilized. The digital flexor tendons and suspensory ligaments support the lower limb. The major functions of all this is that they lock the stifle and hock to support the body weight. By locking their joints, horses can rest and conserve energy without lying down. Now let us compare locomotion in different species. Ungulogrades, hoofed animals, walk on third phalanx, e.g., horses, cattle. Digitigrades, carnivores, walk on full digits, e.g., dogs, cats. Plantigrades, humans, walk on full foot, heel to toe. Now we talk of the muscles of the forelimb. The muscles of the forelimb are divided into two groups, extrinsic and intrinsic muscles. Extrinsic muscles. These muscles attach the forelimb to the axial skeleton and allow movement of the entire limb. Muscles that attach the limb to the trunk. 1. Brachiocephalicus. Origin, skull and cervical vertebrae. Insertion, humerus. Function, advances the limb, extends the shoulder joint. 2. Omotransversarius. Origin, atlas. Insertion, acromion of the scapula. Function, advances the limb and flexes the neck laterally. 3. Trapezius. Origin, dorsal midline, cervical and thoracic regions. Insertion, spine of the scapula. Function, elevates and abducts the limb. 4. Rhomboideus. Origin, dorsal midline. Insertion, medial scapula. Function, elevates the scapula and pulls the limb dorsally. 5. Serratus ventralis. Origin, cervical vertebrae and ribs. Insertion, medial scapula. Function, supports the trunk, acts as a sling. 6. Latissimus dorsi. Origin, thoracolumbar fascia. Insertion, humerus. Function, retracts the limb, flexes the shoulder. 7. Pectorals, superficial and deep. Origin, sternum. Insertion, humerus. Function, adducts and supports the limb. The pictures show the muscles, arteries and veins of the forelimb. Intrinsic muscles. These muscles control movement of the limb itself. 2. Intrinsic muscles. Within the forelimb, these muscles control the movement of the limb itself. A. Shoulder muscles. 1. Supraspinatus. Origin, supraspinous fossa. Insertion, greater tubercle of humerus. Function, extends and stabilizes the shoulder. 2. Infraspinatus. Origin, infraspinous fossa. Insertion, greater tubercle of humerus. Function, abducts and stabilizes the shoulder. 3. Deltoideus. Origin, spine of scapula. Insertion, humerus. Function, flexes the shoulder. 4. Teres major. Origin, caudal scapula. Insertion, humerus. Function, flexes the shoulder. 5. Subscapularis. Origin, subscapular fossa. Insertion, lesser tubercle of humerus. Function, adducts the shoulder. B. Elbow muscles. 1. Biceps brachii. Origin, supraglenoid tubercle of scapula. Insertion, radius. Function, flexes the elbow, extends the shoulder. 2. Brachialis. Origin, humerus. Insertion, radius. Function, flexes the elbow. 3. Triceps brachii. 3 heads in ox, 4 in dog. Origin, scapular and humerus. Insertion, olecranon. Function, extends the elbow. 4. Anconeus. Origin, humerus. Insertion, olecranon. Function, extends the elbow. C. Carpus and digit muscles. Extensors, located on the dorsal side. 1. Extensor carpi radialis. Function, extends the carpus. 2. Common digital extensor. Function, extends the digits and carpus. 3. Lateral digital extensor. Function, extends the lateral digits. 4. Ulnarus lateralis, flexor in horses, extensor in dogs. Function, flexes the carpus in horses, and extends in dogs. Flexors, located on the palmar side. 1. Flexor carpi radialis. Function, flexes the carpus. 2. Flexor carpi ulnaris. Function, flexes the carpus. 3. Superficial digital flexor. Function, flexes the digits and carpus. 4. Deep digital flexor. Function, flexes the digits. The picture shows the intrinsic muscles of the forelimb. D. Suspensory apparatus. The suspensory apparatus include suspensory ligament, interosseous muscle. This prevents excessive extension of the fetlock. The check ligaments support the digital flexors. This table shows the muscle group and their primary action. The shoulder extensors include supraspinatus and biceps brachii. The shoulder flexors include the deltoideus and teres major. Similarly, the elbow extensors include the triceps brachii and anconeus muscle. The elbow flexors include biceps brachii and brachialis. Thanks for watching. Kindly share, like, comment and subscribe. GNP Sir Classes Official. See you again. Bye.